This is 1-year-old Jeremiah Nwagaba. His mother, Barbara Charabevere, says his cry indicates a lot of discomfort. She told us that her son was diagnosed with a liver disease called biliary atresia 3 months after he was born.
After 3 weeks, he started urinating the yellow urine. Then I took him for medication, where they told me it was maybe this local sickness of yellow fever. So I tried to use echogel, the local herbs. At 3 months, it persisted. Then I was advised by someone that I take him to Mulago.
Barbara Charabevire says they were told their child had an infection at all the hospitals they visited. She adds that some of the medics told her the yellow color was normal in babies.
So I keep taking him outside the early morning sun and the late evening sun.
But a number of her visitors thought otherwise.
They told me that it could be yellow fever, or this, the Uganda called it kamuri.
They then started treating yellow fever until they got to a point where they saw no change in the baby's condition. They decided to seek further medical care. They were referred to Mulago Hospital, where the specialists explained the baby's condition.
The scan showed that he has no bile duct, but the other medical people, they didn't know that it is normal up to 3 weeks, which they didn't tell me.
Dr. John Sekabira, a consultant pediatric surgeon at Mulago Hospital, explained the condition to us.
There are ducts which drain bile from the liver, and this bile is supposed to go to the gallbladder, and from the gallbladder it goes into the small intestine to help in digesting of food. For children who have biliary atresia, these small ducts, we call it progressive destruction of this biliary tract, so that the bile which is processed, made in the liver, cannot drain into the gallbladder and into the small intestine.
This internal organ malformation is limited to children because it happens at the development stages of the unborn baby. Dr. Sekabira says there is no known cause for biliary atresia.
But they are, we call them theories which postulates what causes this. Probably we call them, there could be some infections which occur and they destroy the bile ducts, or they are what we call autoimmune processes, that is the immunity fighting its body.
So how then can one tell their child is likely to have it?
These children become yellow after birth. They start with yellowing of their eyes and later the entire body. They also pass what we call pale stools, white stools.
The other symptoms include weight loss and irritability, dark urine, and retarded growth.
Unfortunately, we can't prevent it. As I said, we don't know what causes it.
According to Dr. Sekabira, Mulago Hospital receives an average of 15 babies with this condition every month. However, some of them come in when the liver has been greatly damaged.
The key to treatment is early presentation. When this baby is present early, there is a chance of doing surgery and this baby is improved.
Mulago Hospital offers free surgeries for babies who are admitted in time because they have a chance to heal completely. But when a baby is taken late to hospital, it will require a liver transplant.
And this liver transplant is only available in a few centers, like in Africa, probably in South Africa and Egypt. So it's not an easy option to take.
And this also lessens the success rate of the surgery.
We have a cut-off time. If this baby is present after like 90 days, 60 to 90 days, usually there is irreversible damage of the liver. When this bile accumulates in the liver, it starts destroying the liver and causes what we call cirrhosis.
Jeremiah Nwagaba now requires 140 million shillings to undergo a liver transplant in India, but his parents cannot afford to pay for the treatment.
Even those who know us, they have tried, the friends, we have raised 40M and we feel now we cannot manage on our own.
Jeremiah's mother's hope of seeing her child in her class as a pupil are still far from reach unless he receives the required specialized medical attention. Uganda's neonatal mortality rate stands at 29 deaths per 1,000 live births. According to the Health Ministry's situation analysis of newborn health, that figure has remained the same over a period of 15 years. But the World Health Organization puts it at 38 deaths per 1,000 live births as of 2015. The first 24 hours and the first 6 days of life are the most critical for newborn survival. It is between this time that serious attention should be given to the little ones. Walter Mwesije, NTV.